Sclerotinia is a fungal pathogen that infects broadleaf crops, including lupins. There are two types of infection that occurs in lupins. There's canopy infection, which is when the pods, the stem, the leaves get infected. And then there's also a basal infection, which is when the base of the stem right at ground level and below ground level can be infected. GRDC have been working with CCDM, which is Centre for Crop and Disease Management, and MIG, the Mingenew-Irwin Group. So the GRDC have been working on field trials and pot experiments. CCDM have been working on controlled environment work and in the lab, looking at the infection process and the glasshouse. And Mingenew-Irwin Group have been doing some great work with paddock scale trials that growers are conducting on their own properties.
We usually grow between 1,500 to 2,000 hectares of lupins annually. They're a really valuable part of our rotation in terms of providing nutrition to the soil. The benefits of having a trial on your own farm are that you get to see it on your paddock in your spot where you've suffered the losses from Sclerotinia, and you get to see the results from having the research go on and see what options you might have.
The challenge with Sclerotinia is that you need to apply the fungicide before you see the symptoms, and so that's where growers need to know the risk factors to make decisions about whether a fungicide's worth applying. So the main one is weather. So if it's a wet growing season, we've found you're much more likely to get Sclerotinia developing to the yield limiting levels. And the paddocks that are more at risk are ones with a heavy soil type, because they stay moist for longer and that humidity under the canopy. When the canopy closes over early in the growing season, they're much more likely to get infected. At this stage, we're finding that the humidity is significantly reduced under the canopy if you have a wider row spacing and a lower seed rate, so that's looking promising for reducing infection. With time of sowing, we've found that the earlier time of sowing is much more likely to get early infection and then reach yield limiting levels, whereas if you delay sowing, you generally don't get the same level of infection and potentially not the same yield loss.
Sclerotinia has been a big issue for us in our lupins. The years that it's happened, it sort of can take a tonne off the paddock yield and is quite destructive, and it means you've got to grade your grain at harvest, and it causes a lot of pain on what was potentially a really exciting looking crop. Rotation is one thing we think about, but obviously there's not a lot we can do at the moment. We're really excited about this research in terms of managing Sclerotinia, and as a MIG member, I've really pushed for this research to continue because it's really important. We really want to keep lupins in our farming system.
So far we're finding that the disease is more likely to create a yield impact in Geraldton and the Kwinana port zones, and we've had yield losses on average around 8 to 10% from infection. Our research has found that foliar fungicide applied during crop flowering and early pod emergence, it can be really quite effective at reducing incidence for canopy Sclerotinia, but unfortunately our research has found that it's not consistently effective at reducing basal infection. What we've found in our research is that the wetter the spring, the more likely you are to get a yield response, because as well as Sclerotinia, you'll be managing other diseases that are present and you're more likely to have a good yield potential.